have Jenna Segraves. I would really like to get a little bit more of your background because when I started out in acute care, I was very transparent about the fact that I had no acute care therapy, virtually no. I mean, a little bit in my residency, a little bit as a student. I saw, people after knee and hip replacements in my acute care rotation. And then I saw people after like more general medical issues that brought them in the hospital. But that was like once every 5 weeks. And so when I started in acute care OB, I thought I was just going to bring all my women's health knowledge and pelvic health knowledge into the hospital. And it was just going to be, telling women how to improve their pelvic health before, going home. And I was shocked. Like my first few, and you actually found me the job. So like, let's just talk about that. But then let's just talk about how much acute care knowledge does someone need really within the first 6 weeks of someone giving birth, like how critical it is that we recognize acute care in and of itself as being a specialty. And I don't think they get enough recognition for all that they do, which is why I'm such a proponent for acute care therapists, and I'm willing to do whatever I can to highlight them and spotlight them. So as an acute care therapist, tell me, how did you start to just expand your practice to the acute care or to the OB population?
So my background primarily is in acute care, and I am a board certified neurospecialist. So the majority of the floors that I was working on tends to be on the neuro floor, the trauma floor, neurotrauma ICU. I have a lot of critical care experience, but what kind of opened my eyes to the obstetric population was that I was starting to see individuals who were coming into the neurotrauma ICU or the neuro floor within days after returning home after giving birth. And they were coming in because they were having significantly elevated blood pressure that led to either a hemorrhagic brain bleed or a stroke or seizure activity that led to them now having neurological deficits. And so in the hospital, I was now having to treat them from for their neuro recovery. But maybe they also had a cesarean section that was still very fresh and still very new for them. And no one had ever taught them just the basic mechanics of how to get in and out of bed to protect their incision. And no one was even remotely looking at their vitals. So one of the biggest things with acute care therapists, all acute care therapists know the importance of taking vitals before activity, during activity, and after activity to see how the body's physiologic response to some of the most basic forms of mobility, how their body responds to that. And so my passion really became, hey, I'm seeing these individuals that have had some significant neurological impairments, and they're in their 20s and they have a newborn at home, and their spouse or their parent or their loved one is in complete shock and in disarray because they now don't really know what's going on with their partner or their loved one. They're seeing them in a way that they've never seen them before. They're scared for their life and livelihood. And there's almost always, a newborn on the other side of it too. And so as a neurospecialist, I know how to treat individuals after a neurological event. But if I don't have to, I don't want to. And is there a way that we can actually prevent this from happening?
To be completely honest, like you probably helped me see the value of, yes, we take vital signs before, during, after activity as acute care therapists, but we, in that moment that a person's in the hospital, we have access to a team that's unlike anything that we would have access in outpatient or in home health. And so, why do you think it's important that OTs, especially in acute care, but just all along the continuum of prenatal, the labor and delivery, postpartum, why do you think that we as PTs start to communicate the value of our OT counterparts, especially during this time?
I think that occupational therapists truly play such a crucial and critical role for this patient population. Where to even start with that, right? But one of the biggest things is that after delivery, if this individual now has a newborn, they now have a new role. And they have a new ADL, which is newborn care. And if they're a first-time parent, this is a completely new role that they're having to step into. There is also a very large mental health perspective here. Not all births go exactly as planned, and so there can be trauma associated. If a birth didn't take place the way that they had hoped or had planned, the birth itself can be extremely traumatic. It can have outcomes that weren't expected. And so occupational therapists, I think, really play such a huge role because they help the individual kind of either relearn this new role or learn this new role, or help them, maintain their initial identity as they step into this new role. But they also play a huge role in activity tolerance and being able to identify their endurance and ways to modify their activity to make sure that they're not overdoing it, and what are different things that they can be doing to still get things done during the day, but in a way that conserves their energy.